This morning on BRN, millions of people on Medicare prescription drug plans will see savings. Joining me now to discuss this is Leigh Purvis, prescription drug principal at AARP. Leigh, it's so great to see you. Thanks for joining us this morning.
Thank you for having me.
Let's talk about this Medicare prescription drug plan, and I think there's some caps on some prescription drugs. First, let's start with the drug program, the Medicare drug plan in particular. What exactly is it?
So Medicare Part D is a voluntary part of the Medicare program that covers prescription drugs that you pick up at the pharmacy. And you can access Medicare Part D through two types of plans. One is called a standalone prescription drug plan that only covers prescription drugs. And the other is a Medicare Advantage prescription drug plan. So it offers Medicare Advantage coverage plus prescription drug coverage. And there are about 56 million people enrolled in those plans.
Yeah, and so that's almost a sixth of the U.S. population. And that number, Leigh, is only going to go up because there's an aging America here. So we're going to see more and more people on the Medicare rolls and in particular dependent on prescription drugs. Now, there was some recent news about the program. I believe there's some negotiations on some drugs with some of the manufacturers. Can we talk a little bit about that, exactly what that is, and what kind of savings will that potentially net for users of the Part D program?
Sure, that is actually a really big and frankly historic change that just happened as part of a law that passed in 2022. And what's happening is that Medicare is negotiating the prices of prescription drugs that cost the program a lot of money. So basically drugs that are super expensive or drugs that are used by a lot of people or both. And what has happened is that negotiation process has started. So Medicare selected the first 10 drugs to be negotiated and actually just released the prices that were negotiated last month. So they will become available in 2026. And for the people who are taking them, we are talking about billions of dollars in savings as well for the program. So it's a really big, important change. And it's also just the first time we're actually going to be seeing more drugs selected every year going forward.
Yeah, I was going to ask you about that process going forward. So I think they started off with some drugs that I think have a lot of use cases. And so they negotiated those. But is there expectation that it's 10 new drugs a year? Do we have a number of drugs that will be renegotiated on top of what they've already done every year? Or negotiated, not renegotiated. Not renegotiated, I mean negotiated. My apologies.
No, that's a great question. And yes, that number of drugs is actually going to increase over time. So for this first year of negotiation, they selected 10 drugs. For the following 2 years, they'll be selecting 15 drugs each year. And then every year after that, they'll be negotiating 20 drugs. So the number of drugs that are negotiated will be growing over time. And yes, we're talking about dozens of drugs potentially in the relatively near future.
And does it matter when you enroll in Medicare Part D? Could it be if I enrolled prior to the new law taking effect, or does it count only for certain groups of enrollees?
This is available to everyone. So those negotiated prices will be available to everyone in the Medicare program. This first round of drugs are drugs that are specific to Medicare Part D, which you asked about previously. And eventually they're going to add drugs that are under Medicare Part B as in boy, which are those drugs that are administered by healthcare providers. So eventually all prescription drugs are going to be available to be negotiated.
And, as people I know we're kind of in the enrollment period for Medicare. Are there things that maybe new enrollees or re-enrollees should be thinking about with respect to this new law and these negotiations when they're considering their enrollment?
That's a great question. There are a lot of Medicare Part D plans, and there is a lot of variability among them in terms of how much they charge for your monthly premium, what sort of cost sharing you face, what sort of pharmacies are in network. It's really important to take a look at those plans in detail and figure out which one covers the drugs that you take and whether they offer them at a cost sharing that you can afford, because it's a really important part of your healthcare coverage. So we have been very aggressive in making sure that people are shopping every year. There's a period of time when you can actually revisit your Part D plan if you're already enrolled in one called Medicare Open Enrollment, and that runs from October 15th to December 7th every year. And it's incredibly important for people to take a look at their plan options and make sure they're in the best one for them.
Yeah, and it's almost like it's not the same, but it's analogous to shopping for car insurance or shopping for other types of products. You have to do the due diligence and you can't just set it and forget it.
Exactly. There is a lot of change that can happen from year to year, even if you stay in the same plan. So making sure that you are in the right plan, again, cannot overstate how important that is every year.
And I know AARP was very involved with supporting the negotiation of these drug prices. Obviously, Medicare, as we've discussed, is an important benefit. Are there other, here we are in an election year, and we're not a political network, but are there things that you're hoping to hear, or AARP is hoping to hear from the candidates in terms of further improving Medicare and in particular the drug program?
I think it's safe to say that AARP has been engaged in efforts to ensure that the Medicare program is available for everyone for as long as they need it. And so making sure that Medicare is financed in a sustainable way is incredibly important. This new law that is going to allow Medicare to negotiate and cause a lot of other changes in the Medicare program is a positive step forward. But of course, more work needs to be done. So that's certainly something that we're going to be looking for.
Yeah, absolutely. And as we discussed, Leigh, more and more Americans falling into that age 65 category every year. I'm getting relatively close. I'm not there yet, but it's an aging America, and clearly this benefit, Medicare, as well as other important programs, need to be supported.
Absolutely. I always say that if you're very lucky, you get to be a Medicare beneficiary, and making sure that that program is available to everyone and affordable to them is incredibly important. So yes, with an aging population, it will become even more so.
Yeah, really important. Well, Leigh, thank you so much for stopping by the program. We really appreciate it, and we look forward to having you back again very soon.
Thank you for having me.
And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place. Until tomorrow, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.